My name is John Fratty, and I'm suffering from Levaquin toxicity, and this is my father to my right and my sister to my left. Ironically, I was a pharmaceutical sales rep that actually used to sell a drug that contained Levaquin in it.
When my brother took Levaquin, I myself took Levaquin just for a day and had a terrible reaction from Levaquin, and I only took it for one day and had to move on to another antibiotic. I think it's so upsetting, basically, that your doctor and the pharmaceutical companies work together, and basically they don't understand the symptoms that you have, and if you come to them and tell them it's from something else, and they're not going to blame any antibiotic they've given you or any other medicine that they've given you. So it's just so upsetting and distressing to see him through several years have gone through this when it's something that your doctor gives to you and says, take this and you'll be fine.
The most serious problem about misprescribing of antibiotics, fluoroquinolones, or any other drugs is the inadequate information that medical students, residents, and doctors get, and into this vacuum comes the massive amount estimated recently in a study by two Canadian researchers to be $58 billion a year in advertising and promotion of drugs. So the main input that people get, residents, practicing doctors, is propaganda from the industry, often misleading because the FDA is doing a terrible job regulating the accuracy of drug ads.
Even being a drug rep that sold antibiotics, I never even knew that fluoroquinolones could do such potential damage. I certainly never would have taken this drug had I known the side effects. I wouldn't even put an aspirin in my body before I took Levaquin. I was very athletic, playing a lot of sports, racquetball, baseball. If I sustained a sports injury, I would refuse to take any type of painkiller. I was just the type of person that would just tough it out. I didn't want anything in my body. Nobody has a clear-cut answer as to how and why they do what they do. My own avenue to try and warn the public about this is through YouTube.
Levaquin. Since that time, 2 years ago, I've been in intense pain, neuropathy, nerve pain, tendon damage. I've had central nervous system damage to my brain. I've had terrible insomnia where I've only had 2 to 3 hours sleep a night for almost an entire year. I've had brutal palpitations, anxiety, panic attacks, tremors, bouncy vision, inability to walk straight. My balance is completely screwed up. I have bouncy vision, floaters in my vision, tinnitus. I must have over 40 different symptoms from this antibiotic.
John was in pain every day, every single day, 24 hours a day. Even at nights, he would scream a little bit and say that I'm in severe pain. He couldn't sleep well at night, and there wasn't much I could do about it. But he's in pain all the time, every day. Even today, he's in pain, and
That's good.
so I'll stop at that.
I have head tremors. It's almost like I have Parkinson's disease. That's what my head feels like 24/7, although it's not visible. My head just constantly rocks back and forth.
The adverse reaction, other than tendon ruptures and so forth, that I'm most familiar with are some mental changes. There are a number of very well-documented cases in which people who were perfectly normal psychologically, once they started using these drugs, had some very abnormal psychological events. And in many cases, this is reversible. In some cases, it's persisted after the cessation of the drug.
I think the reason the FDA is concentrating on the tendon damage is because that's something that's very easily identifiable compared to central nervous system damage. It's hard to, as a patient, when you go to a doctor and say you're suffering from anxiety, insomnia, panic attacks, a doctor can very easily say, well, that's something that's being driven by a situational type thing.
The FDA website, which is fda.gov, has a very easy to fill out, consumer and doctor-friendly adverse reaction form. It's called MedWatch. So anyone who goes to the FDA homepage, fda.gov, can report that themselves. It's interesting that in the last 5 years or so, a larger and larger proportion of the adverse reaction reports coming into the FDA are coming from patients.
The FDA does get adverse event reports into the agency, and they are open to the public so that you can get these from the agency. They're available online. And the question is the FDA on top of everything that comes into it? Well, in fairness, no. It's important that that information is available to the public so they can also act as a watchdog. My organization, Public Citizen, our health research group, watchdogs that information pretty intently in terms of drugs and medical devices. And certainly investigators, researchers around the country try to do that too. We would hope that the FDA does that also.
I felt the need to file multiple MedWatch reports because I wanted the FDA to know that my symptoms still persisted after 2 years, after 2.5 years, that I was not getting much better. And I also filed multiple times because I wanted the FDA to know that this is something that obviously needs a lot of scrutiny.
That's the scary thing, is that the FDA seems to be ignoring that they have a very dangerous class of drugs out there.
I remember hearing about tinnitus beforehand. I was like, wow, that'd be awful to have that. I took the Tequin pretty much right after the surgery. It started getting a little worse. The ringing started, so I thought it might have been due to some trauma or something like that from the surgery. They're like, no, you're fine. And all of a sudden, I just took the medicine more and more. It got worse and worse. And I really didn't think about it too much. I think, all right, my body's just really like freaking out from, recovering from the surgery. And then, so I took the full cycle of the Tequin. And then he mentions the word ototoxic. And I'm like, what's that mean? And he goes, well, it's when you get ringing in the ears from the medicine. I go, well, what, go away once he goes, no. Well, these are $1,500 a piece. That's $3,000 right there. These are like $100 a piece. Not covered by any type of insurance whatsoever. The medicines can burn your inner hairs in your ear. It's done. You can't get this back. And luckily it didn't affect the hearing, but now you have a ring, it sounds like a fax machine. I would have never took a chance if I knew it was ototoxic. Chronic pain, you can't just put out of your mind, and it will affect you. And if you're a nice person, you're no longer a nice person. You don't want to be around people, and you don't want people to have to deal with you being not so nice because you're not feeling good all the time.
In some cases, the situation is the product was really poorly designed or poorly manufactured. And yet, the argument from the manufacturers is, well, it was approved by the agency. So even if it was, we learned later that this thing was not designed correctly, you lose. Sometimes you have situations where the company covers up, the fact that it was unsafe. But other times, people just didn't know. And if they didn't know, we want a civil justice system that induces people to take those kind of products off the market and also compensate people for the harm.
There are more instances where we have tried to get a drug taken off the market rather than just a black box warning. A black box warning is appropriate if the drug has some use and needs to stay on the market. It is inappropriate if the drug is exceeded in its safety by a lot of other drugs and doesn't have any unique benefits. And so for the 30 or so drugs that we have asked the FDA to ban, all of these drugs have unique risks, no unique benefits. There's a much smaller number of instances where we have asked the FDA to put black box warnings on drugs than to ban drugs.